this is Dr. Adam Kopsky coming to you from Advanced Rehab and Medical in Jackson, Tennessee. I hope you all had a wonderful weekend. I wanted to come on here and tell you about our fascinating topic of this week for the whiteboard topic of the week. And once again, there's these little handouts in the front desk, receptionist area, and over by the rehab area. So when you come in, just grab one of these, and we have a really cool, like I said, fascinating topic this week, and I just want to tell you a little bit about it. So this week's topic is talking about whole body health. And so what we have this week is cholesterol. And so many of you have heard about how high cholesterol is bad, and you know that's just kind of the big things where a lot of you may be on medications to lower your cholesterol. And one thing that I want to tell you a little bit about as far as what cholesterol is, if you don't know, it's just a little waxy fat substance that's in our body. And so basically what the doctors will tell you is that you want the cholesterol to be below 200. And so there's two different types of cholesterol, which we have the bad cholesterol being LDL and the good cholesterol being HDL. And so if you don't know, what you need is the LDL stands for low density lipoprotein. And so this cholesterol, it's formed in your liver, and it is transported from your liver to organs and tissues. And so what the LDL does is take that from the liver to your organs and tissues to function properly. And what happens is if that level gets too high, it'll get clogged in the bloodstream, and so over time that can lead to plaquing, and so that can cause atherosclerosis, and then leading to hypertension, and then that prolonged can lead to, some heart attacks and strokes. So it's very imperative to keep that LDL low. However, we usually want to see a good ratio of the HDL, which is our high density lipoprotein, which is our good cholesterol, and so that'll be primarily take that cholesterol from your organs and tissues back to the liver to be resynthesized and stored. And so that'll actually come up and take that cholesterol out of your bloodstream, and so it'll remove those plaques and kind of clean all that debris up, so you'll be functioning healthy and kind of lower all that debris in the bloodstream. And so it's kind of one of those things where they talk about having high cholesterol is bad, but in theory you want that ratio of HDL to be higher than the LDL. So it's kind of those things when you hear high cholesterol, what are we talking about? Is it the LDL that's high or the HDL? So really, ultimately, you want that total cholesterol, the total under 200. However, what's fascinating with this topic, coming full circle, is they've actually found studies that having high levels of cholesterol has been helpful, more so than having low cholesterol. And so one study done by Yale has actually found that those that had low cholesterol died twice as often from heart attacks as those compared that had high cholesterol. So one thing they didn't go in depth in is I would like to see the ratio between LDL and HDL. So they just, in the study, they just just stated high cholesterol. So I would like to see more on that study, because it makes more sense if that HDL was higher than the LDL, then that would be true. So one thing is that we should start looking into more so than cholesterol is our inflammation in the body. So what we're seeing now is more of these terrible diets we're eating, we're eating sugars, and candy bars, simple sugars, is leading to chronic low-grade inflammation in the body, as well as not getting enough sleep or regular exercise. So if you can just get a regular routine, get plenty of sleep, focus on eating greens, vegetables, and fruits, you'll really start getting that inflammation down, as well as getting a regular routine, getting exercise, whether that's taking a break and walking more and just getting up and moving around. You'll start feeling better, as well as getting plenty of sleep. So when we hear the term high cholesterol, we need to really start thinking back on, well, what are we really looking at when we want that term? So anyway, thanks for listening to me. When you come in, be sure to grab this handout, and if you want to know more about it, just come grab me or one of the staff members, and we greatly appreciate explaining it more in detail to you. So look forward to seeing you this week, and have a great week ahead. Thank you.